Thank you very much, and welcome back. And now we have the privilege, I just want to make sure, oh, he is here. Okay, we have the privilege of hosting Dr. John McWhae, who will delve into the role of exercise as a primary treatment for ankylosing spondylitis. Dr. McWhae is a Calgary ophthalmologist and a lifelong athlete who was diagnosed with this type of arthritis at age 35, although he had shown symptoms as early as 15. Dr. McWhae has demonstrated remarkable resilience, and it's through cycling that he has seen improvement in his symptoms, leading him to be an advocate for integrating exercise into treatment plans for chronic conditions. Ladies and gentlemen, please join me in welcoming Dr. John McWhae.
Well, it's a pleasure to be here and speaking to you about something dear to my heart. So I am a physician, as mentioned, but I'm speaking to you today as a patient. And some of the photos are from my not-for-profit photographic business. So if you aren't a patient yet, you will be. And so what can you do? What's your side of the equation on illness? We've been thinking about what all the doctors can do. Well, what can we do for ourselves? So ankylosing spondylitis I've had for about 45 years. It's a condition that is variable in severity, but it can be debilitating or debilitating at times. For myself, I've had many manifestations of it, but the most continuous thing has been my feet. And things like a museum visit or a stand-up social function are really difficult for me, although I can do a lot of other things, as you'll find out. So since I've had the condition, it's been renamed twice, and it hasn't helped. Still, no one can say it and no one can spell it. And that's just the way it is. So I hope that the fourth one will be better. So my journey included a number of empowerments from various sources. And we'll talk about where that can lead. So my current treatment is exercise-based, many hours a week. And I use my exercise also for treating acute flare-ups. For example, if my back was terrible, in the past that would involve an appointment with my physio, taking a bunch of medications, maybe seeing my doctor. Now it involves me hobbling out to my bike. It's quite a sight to see if anyone's watched it, and I get on it and I go for 2 or 3 hours and I come back and I'm good and I haven't accessed the healthcare system. Similarly with my feet, strangely the best thing is to get on a stand-up paddleboard and go for an hour. So when you do these things, when you learn these things, you'll see your healthcare team less, but they'll like you. So as a young person, I did the typical pounding and slamming sports, which are hard on joints. And I ended up having to give up all of these sports. And in '95, I had a terrible flare-up and was off work for months. And I was beginning to feel like a patient, and I just desperately wanted some sort of cure. And I met a wonderful physio, and she suggested I needed to move side to side. So this is Nordic skate skiing. So I took up Nordic skate skiing. And my first ski was 2 kilometers. My second 2 days later was 4 kilometers, another rest day 6 kilometers, until I got to 40 kilometers, and then I was ready to go back to work. So the second step, more empowerment, is always important. It's like the second date. If you don't get continue it, well, that's about it. So I began to rebuild and expand my toolbox, and I rollerbladed for the years that I couldn't ride a bike, and always with full safety equipment. So here I am Nordic skiing. Nordic is the light, fast side of cross-country skiing. This is classic technique. And on this slide, on the right, you see my wife, Sandra, snowshoeing. Canadians need a winter sport. We really do. I mean, you can do everything indoors. There are options, but to have an outdoor winter sport is great. Snowshoeing, you really can't hurt yourself. And you really don't need a lot of lessons or equipment. Backcountry skiing. This is going up using climbing skins for traction. This, with my foot in a rigid boot, I can do this for a week and I'm 100% comfortable and just having fun. And coming down is definitely fun, very soft, very smooth. So after 10 years, I found a way to ride a bike again. I had tried several recumbent bikes, and then I got on one and I knew I could ride it, and I was back on the road and I was feeling very excited. And after 3 years, I was to the point where I could actually dream about things. So being a dreamer is something an athlete does. It's also something academics do, as we've heard from my colleagues. And I had the idea that I wanted to ride a bike across Alberta in daylight, having not ridden for 10 of the 13 prior years. So I built a this one I bought. I bought a fast bike, and you can see the powerful effect he had on people. So the fourth empowerment actually came from a whiplash injury. I was rear-ended, and I had to take a week off, which meant I had lots of time to think about things, and I thought it was time to move on to more ambitious projects. So I ordered a frame, and I built Massimo. Now, Massimo's actually here today, so we'll bring him out. He's not very shy, don't worry. So among other things, I use principles I learned from occupational therapists designing this bike to be totally comfortable and fast. So then it was time to do a 300-kilometer ride. I wanted to do a longer ride than I'd done before I took on the province of Alberta. So I decided to ride from home in Calgary, west to Kananaskis, south over Highwood Pass, which is the highest paved road in Canada. The summit's 2,200 meters, 7,300 feet. And here I am on the summit, and I'm smiling because I've just finished 150 kilometers uphill, and now I have 150 kilometers downhill to work my way back to Calgary from the south. Now, this was the final empowerment that actually got the idea in my head that I wanted to treat my condition primarily with exercise. I didn't want to be on an immunosuppressant during COVID, given there was concerns about heightened chance of infection and potential immunization exclusions. So with my very progressive rheumatologist, the plan was I would increase my hours substantially and stop my medication, and that was 4 years ago. I'm finished with that. So, what does this actually look like? Thank you. Okay, this is what it looks like. Now, this is This is me currently trying to treat without any medication, but the principles are the same. Details are critical. If you're not a detail person, make an exception. So it's got to be safe. You don't want to crash trying to improve your health and you take a crash because you don't have the right equipment or the right safety equipment, or you're out with people who don't know what they're doing. So you have to be very careful. Most of my mileage is very, very easy, but I do a lot of mileage. And there's lots of people, professionals, and things that you can use to help. And I say that you need to be aware of competition, even informal. When you're using exercise, you need to go at a pace that works for you, and you need to do things that work for you. So don't get caught up in the local spontaneous bike race unless you're feeling really good and you have thousands of kilometers behind you. So this month that's showing here has just happened. That was September this year. So I exercised 20 days, 70 hours, almost 1,400 kilometers on the bike, and almost 8,000 meters of vertical climbing. Oh, and that's some of the tools. And that's towing the world's largest dump truck. It was actually pretty hard. So with a fantastic partner and a team, you can try something ambitious, even with arthritis, if you're prepared for it. It was time to take on the ride across Alberta. I was partnered with McWhae Institute to increase awareness of exercise for arthritis. We had some issues. We had 3 flat tires, some nutritional issues, which led to some cramping. But our team addressed all of these things, and we were all really busy with all this stuff going on. So the time for the crossing was 11 hours and 39 minutes, and the average ride speed was 37.2 kilometers an hour. I actually rode for 10 hours. And if you look at the 2 graphics, they actually represent the same thing. So on the left side is BC-Alberta border, on the right side is Alberta-Saskatchewan border, and you can see my route across southern Alberta. The speed graph shows the speed across that distance. In order to average high 30s, you need to be riding faster than that because there's always slowdowns and hills. So most of the time is spent between 40 and 50K an hour. Just some kid going for a bike ride. This is early in the day. That's Crow's Nest Mountain behind. Cruising along, you can see my support vehicle behind. And here we go, only 300 more kilometers to go. So I wanted to do a Nordic World Cup ski race in 2010. In 2010, I didn't ski all season. I had a major flare-up. However, I did in 2022. So this was the longest and first international level race I've done. It was at the Canmore Nordic Center, and it was a wonderful experience. And it goes to show you that dinosaurs can ski. So then I wanted to actually do a recumbent bike race, and there are none in Canada. So the closest one was a world 6-hour time trial in California, and we did a bit of research and thought we'd give it a go. So what the time trial format means, you can't draft behind other bikes, and the goal is how far can you ride in 6 hours. So with the various problems that I had, we really weren't experienced for this level of race. I actually rode for 5 hours. I covered 179 kilometers, and that was good enough to win the men's recumbent division. Okay. So, some things to think about. I have been able to actually get to the point of treating my arthritis primarily with exercise. It is a huge time commitment. I've learned that illness has a schedule of its own, and you have to be flexible. The ride across Alberta happened 13 years later than first planned. My Masters World Cup was 12 years later than planned. And the final event actually was as planned. You don't beat chronic illness, but you can influence it through exercise, and occasionally you can show it who's boss. So if you haven't taken the first step, then I'd encourage you to take the first step. It started with one physio suggesting one thing for me. Thank you.
Thank you. Thank you, Dr. McWhae. Did you want to add anything with Massimo?
Well, yeah, this is him.
So did you actually, sorry, I'm kind of going off script a bit, but did you constructed this then?
I did, yes. I bought the frame. So in working with occupational therapists years ago, I learned a lot about ergonomics, and then along the way, I've learned to work with carbon fiber, titanium, aluminum, whatever.
Amazing.
Thank you.
Do you have this as a sideline business? Can we order these bikes? Thank you, Dr. McWhae. Very, very inspiring, and yeah.
Okay.
Yes, movement is medicine. I just like to always reiterate that and reiterate in my own mind how important it is we try to keep moving. Today